Guys, I'm presenting my crisis counseling project on caring for families who receive like a difficult prenatal diagnosis. And by that, I mean families who are expecting a child, and in the midst of the pregnancy and the regular checkups, they discover that something's wrong, whether that's through an anatomy screen, as was the case for Noelle and I, excuse me, or maybe it's with genetic testing. So I'm going to jump right in. So prenatal diagnosis is when a medical professional, typically obstetricians or OBGYNs is what they're more commonly known as, communicates with a family when there is a developmental issue within the womb. And receiving these different types of diagnoses can be difficult for parents in a variety of reasons, depending on the severity of the diagnosis. In some cases, parents are told that their child will be born with a certain disorder or abnormality that will result in the child only living for a few minutes, hours, days outside of the womb. And in some of these cases, there's nothing they can do to kind of mitigate those causes. Other times, they can operate and correct some of those different abnormalities, but that still results in a lot of difficulty for parents. So we're going to take a closer look at what that looks like. So here are the 10 most common birth defects in babies in recent years. So congenitive heart defects or CHDs occur in 1 in 110 births. That's what our son will have. He will have a congenital heart disease. It's called hypoplastic left heart syndrome. Hypospadias are 1 in 200 births. Ventricular septal defects, 1 in 240 births. Clubfoot, 1 in 593 births. Down syndrome in 1 in 700 births. Pulmonary valve atresia in 1 in 1,052 births. Cleft lip with cleft palate, 1 in 1,563 births. Cleft palate, 1 in 1,687 births. Atrioventricular septal defects in 1 in 1,859 births. And then limb defects occur in 1 in 1,943 births. So as you can see, some of these heart defect or some of these birth defects or abnormalities are more common than others. And as a result, that will kind of affect how much community and support that a family can find when they receive a certain type of diagnosis. Obviously, with the most common being CHDs, because it's so common, most of the time you can find someone, or you might even know someone who was either born with a CHD or who has had a child with a CHD. So you have a lot more support there. But as you can see with limb defects, 1 in almost 2,000 births, you might have a much harder time finding someone who can relate to kind of your struggle, what emotions you might be feeling in your overall situation. So grief can very easily occur with prenatal diagnosis, and not even necessarily with a fatal diagnosis. And these various birth defects can have better long-term prognosis than others. Parents will still experience a certain level of grief. For example, when parents discover they're expecting a child, as was our case, a lot of the time, the most immediate emotion is fear, a little bit of anxiety. Obviously, it's a massive, massive stage in life that a lot of people don't feel they're prepared for. And in my opinion, no one is ever fully prepared to be a parent, no matter how much that seems they might. It just comes with so many different complications, and it really changes the stage of life that you're in. And people who don't have kids just won't understand. But typically, families eventually will come to terms with this new stage of life that they're going to enter into, this new life that's growing inside of the mother, and they begin to get excited, as you should. You start planning names, you start planning what their nursery is going to look like, you start shopping for baby clothes, and a lot of that anxiety turns into excitement. Obviously, there's still fear there, but a lot of that turns into excitement for who this baby might become. And what's a little tough when people do receive these kind of diagnoses is that moving into the stage of excitement all of a sudden is torn away from them when they receive a hard diagnosis. But initially, as pastors, what we need to do is to, some people might see pregnancy as a crisis that they need counsel through. So the first stage for us as pastors would be to communicate accurately and clearly with families that babies are not inconvenience. They're not going to rob your freedom. Psalm 127:3 says, "Behold, children are a heritage from the Lord, the fruit of the womb, a reward." So that's the first step we have to take as pastors, is often making sure families know that these babies are blessings. And after receiving a hard prenatal diagnosis, many families feel robbed of their plans, the expectations they had formed, and the hope for a normal, happy pregnancy. And that was the case for us. That was certainly one of the emotions we went through. Envy was definitely something we felt. We knew so many people who had normal, healthy pregnancies, and we just felt like we couldn't relate, and they couldn't relate to us because the situation we were going through seemed so dire. So immediately after the diagnosis, families are going to feel a flurry of emotions. Many of them, they won't even know how to identify. I know that was the case for us. Sadness, obviously. And I don't think we realized immediately what we were experiencing was grief. The journey that we had planned for all of a sudden had drastically changed, and we couldn't understand how we were going to function moving forward. And like I said earlier, the prenatal diagnoses don't necessarily mean that the child is going to die of the disorder, abnormality, or whatever. Obviously, in the case of something like Down syndrome, it's typically not fatal. Very rarely, I think, is something like that fatal, if at all. I didn't do my research on that, so sorry. But these types of diagnoses do mean the death of the child as they had envisioned it. And that's hard to wrestle with. But the child that the family had been preparing to meet for weeks and months suddenly no longer exists. Instead, they're faced with a new baby with new complications that they were not anticipating. Families grieving in this way are not only grieving the child's health, they're also grieving the loss of their own life as they know it. Many babies survive certain defects and disorders. They are going to require lifelong specialized care and attention. For example, with hypoplastic left heart syndrome, the baby is going to experience an open heart surgery at 7 days old, and then will spend 4 to 6 weeks in the hospital recovering from that operation. And following that, we'll be returning for appointment with cardiologists bi-weekly, with appointments with pediatricians in between. So there's a lot less freedom. Obviously, a lot of your life revolves around doctor's appointments with some of these disorders. So that's something you'll have to adapt to as well. It's important to recognize that the families who are experiencing these types of diagnoses are likely feeling robbed of happiness and normalcy. And a lot of people are going to ask, will my life ever be the same? And I think what's important to note is that when you have a baby, when you have a baby, whether healthy or not, whether they have birth defects or not, life as you know it won't exist no matter what. Your pregnancy journey, your journey as parents, is just going to look different from everyone else's. And likely no one's pregnancy journey, no one's journey as new parents ever looks the same. Denial will surely settle in. I know it did for us. We said things, surely the doctors were wrong. We need to get a second opinion. We were thinking when we go in and they scan us with higher quality, higher tech equipment, that it was a mistake and that his heart would be fine. Obviously, that was not the case. We're still praying for healing. But while getting a second opinion should never be discouraged, something we will need to do as pastors and care and people who care for our congregation, you need to be alert and discerning as to whether these emotions, these kind of grasping for hope, is well-founded, or if it's a hopeless clinging to a chance that the doctors made a mistake. Eventually, we need to help them come to terms with the diagnosis, as that is the first step to healing in something like this. And it's part of our job to assist families in coming to terms with their new reality. Walking with families through this kind of journey is not going to be a one-time event either. These type of diagnoses can come with lifelong complications, both for the family and the baby themselves. I know for us, even after they have his first operation, there's still risk that he could just die, that his heart could just give out. So pastors need to be aware of the situation that the family is experiencing, what complications might surround these types of disorders, abnormalities, or the treatments that are going to be used to treat the disorders as well. So common questions that families are going to be asking themselves, maybe going to be asking you as a pastoral caretaker, is what did we do wrong to cause this? I know that's something we really wrestled with and it was hard, but the answer is a lot of the time, and it's depending on the abnormality, the families themselves did nothing wrong to cause this to happen. With hypoplastic left heart syndrome, they have no identifiable cause for the heart condition. They have no real understanding of why it happens. And that's something that we need to help our parishioners understand, is that you didn't do anything wrong to cause this to happen. Another question, and this went more through my mind, I think, than Noel's, is why did God allow this to happen? And is he punishing us for something we did? We need to emphasize in these situations that God is a God of grace and that Jesus took punishment for sins on the cross. God does not punish sin with birth defects or cancer. That he doesn't do that because Jesus took the burden of the entire world's sin on the cross. So there's no reason for God to, go back on what Jesus had done and punish us. We need to keep in mind verses like John 9:2-3. When they encountered the man who was born blind, and his disciples asked, "Rabbi, who sinned, this man or his parents, that he was born blind?" And Jesus responds, "Neither this man nor his parents sinned, but this happened so that the works of God might be displayed in him." With these kind of families, their response to the diagnosis, their response to the operations, to the long hospital stays, that is going to be a testimony to God's action in their lives, whether it ends well or whether the baby sadly passes on. And when parents are faced with these kind of diagnoses, many are going to wonder, will our lives ever be the same? And like I said earlier, when anyone has a child, healthy or not, their lives are radically changed forever. No two families' journey into parenthood is ever the same, regardless of abnormalities or lack thereof. And when faced with questions of why did this happen, we need to keep in mind a few different things. One is we live in a fallen world. Ultimately, sin is the source of pain, grief, sickness, and death, but also that God can redeem any situation. The story of how God uses us and is with us in the darkest times are often our most powerful testimonies to his goodness. And finally, do not be afraid to sit in tension with the person. A lot of the time, parents won't necessarily want answers. They want someone who will listen to their hearts without fear of being judged for the questions they ask or the emotions that they feel. We will have to be careful to steer them away from blasphemy. However, lament is totally fine to do. But as we see in the lament psalms, David always finishes a lament psalm with praise to God's goodness, regardless of the situation he has found himself in. Parents who receive these diagnoses don't need pastoral care over a few weeks or months. It's likely going to be years long of continued meetings, of continued pastoral care. And these conditions can come with lifelong complications, as I mentioned before. So being present and mindful of the situation of the family and the family's schedule is key. In the case of diseases like hypoplastic left heart syndrome, as I mentioned, we'll be in the hospital with our baby for 4 to 6 weeks. And my pastor is aware of that, and he's been communicating with me as we come up to the delivery date. As pastors, we need to find ways to meet not only the spiritual needs of the families, but also the physical needs. Many families are going to be in different circumstances socioeconomically. And the fact of the matter is, a lot of families will not be able to afford open heart surgery, as is the case with something like hypoplastic left heart syndrome. I'm a resident making $15 an hour, and my wife's a teacher making about 40 grand a year. So all these added Hospital bills, which are frequently $900 or more for 2-hour doctor's visits for ultrasounds. We get those bills and we just have to set up a payment plan. We can't afford to just pay them all out of pocket like some families might. So pastors need to be aware of the socioeconomic status of families as well in order to devise the most effective care plan for them. Families are going to encounter a lot of different problems, and they're going to need help to get back to a sense of normalcy, or as close to it as we can get. As I mentioned earlier, there's increased financial pressure. Many of these diagnoses will require many doctor visits, and the bills will rack up very quickly. Secondly, difficulties keeping or finding work is an issue some are going to run into. Families dealing with these issues long-term may become full-time caretakers for their child, all while trying to maintain full-time jobs. And the fact of the matter is many workplaces aren't charities, and they won't give the time off needed that a lot of these kids will need. Lack of time. The demands for caring for children with birth defects or abnormalities is going to require a lot more time and attention from the parents to keep the child safe and to keep the child healthy. Lastly, parents might experience a loss of identity. Much of their lives will now revolve around caring for their children, so we need to be prepared to help them recenter and refine their identity in Christ, not as a caretaker, but as a child of God with a purpose. And finally, these are just some practical recommendations of how churches can care for families who are going through circumstances like this. Because a lot of these issues, a lot of the hurdles that these families are going to face are too large for just us as individual pastors to deal with. So allow the church to really be the hands and feet of Jesus in helping to meet the needs of these kinds of families. Does your church have a crisis fund to assist families in paying for increased medical expenses? Are there business owners or executives who might be willing to employ parents with complicated schedules and needs? And I mean, in the congregation. Are there any caretakers who attend the church who can lighten the burden on parents, enabling them to return to a sense of normalcy? Maybe watching them once a week so that parents can go out and enjoy a date night. Another practical tip is to organize a meal train to help feed the family, especially surrounding surgeries and prolonged hospital stays. Lastly, enlist the help of congregation members to fundraise to help lighten the burden of these financial struggles that these families might encounter, whether that's helping them pay rent for a month or whatever it might be, depending on the specific situation of parents. Be creative in equipping your congregation to do the work of ministry and meeting the needs of these families. Thank you.